Naren, I'm going to ask you to cover a handful of things
Yes.
that are important to master when it comes to Google. And I want you to talk about NAP consistency. Secondly, unique content with no duplicate, lighthouse scores, and search engine terms and phrases. Would you cover those in rapid fire?
Absolutely, Gary. Let me define dental marketing, at least based on my 15 years of experience. It's two parts. One is helping your ideal patients find you, and then helping them choose you. And today, 90+% of patients, the way they find you is through search. Like Gary touched on, they are not typing in one term like dentist in my city. They're typing in hundreds of terms specific to their need at that moment. Hey, I have a toothache. It's 8 p.m. The keyword might be, dentists open in evenings. Or they're looking for implants. Then they could ask 30 different types of queries related to implants. Cost, horror stories, zip codes. So they put all kinds of combinations. We start by studying Google Analytics and we try to find out what these keywords are. And of course, there are some patterns that we notice across the US. So that's the first part, right? Helping people find you. And then the second part is, okay, fine, they found you, how to make the phone ring. And that's a totally separate discussion. We'll put a link to a podcast that Gary and I did around influence. And that might be something you might want to listen to, that, okay, fine, you are ranking for hundreds of keywords. How do you get those people to pick up the phone and call you? So now let me dive into Google. Let me talk about the specific 4 things which are at the top of the list when you want to think about Google. I want to say a couple of things about Google. Google makes $250 billion a year because all these businesses, mostly small businesses like yours, dental practices, pay them billions of dollars in ad money. And that's how Google runs. That's what feeds Google. So to make the ads work, or at least get you to pay so much money for ads, they have to make organic really tough. So they did something really smart. They said 90% of the web pages on the internet get 0 traffic, 5% of the web pages get 95% of the traffic. So the $1 million question is, how do you get into the top 5%? And to get into the top 5%, Google has given us, 7, 8 things to pay attention to. And I'm going to focus on the top 4, which is what Gary talked about earlier today. So think of it like this. To get into the top 5%, you have to get an A in every one of these areas, actually an A+. That's how Google decides whether you are in the top 5% or not. I mean, you went to dental school, you know the game, right? So if you are not in the top 5% of your class in so many subjects, you're not going to get into dental school. Same thing here. It's a concept that we all understand. So NAP stands for name, address, phone number consistency. And what it means is there are hundreds of directories out there that has information about your practice. And you want to make sure more and more of these directories have consistent name, consistent address, consistent phone number. So your name, including spaces, punctuations, all these things have to be exactly the same. Same thing with address. If you spell BLVD, in your address as BLVD for Boulevard, then every listing out there on the internet should have the exact same spelling. Literally like a pattern match. So that entire address phrase should match exactly. So when we start with a client, we start cleaning them up. Now, Life Smiles, for example, there are more than 100 profiles that we have been able to clean up over 6 years and that have consistent name, address, and phone number. And it's never ending. That's how Life Smiles, is getting ranked for 600 plus keywords and is getting more than 100 new patient calls. Let me touch on original content. I think Gary used the word, what was the word? Unique content. And I just want to kind of
specifically no duplicate content.
No duplicate content, exactly. What Google is doing is Google is made up of software programs. So they're doing, again, pattern matching. If they see any phrase or any group of words combined together, they think it's duplicate, meaning they think somebody copied somebody. So they have a threshold of 5% or less of duplicate content. So let's say your web page has 400 pages. If Google sees 20 of those words kind of written the same way in the same phrases, they will forgive you, so to speak. If they see anything more than 5% that's duplicated, they will punish you. So Google has guidelines on how many words and how to structure your page, plus very strict on duplicate content. So we use a tool called Copyscape. 70% of the clients we talk to before we start working with them, we find this issue, at least 70%. Sometimes it's even higher than that. The next thing we talked about is NAP, Lighthouse Score. I think.
So next was Lighthouse Score, and then the fourth category that I'd like you to kind of enumerate is keywords and key phrases.
Perfect. So Lighthouse Score. So every single page on your web page is ranked on 4 categories. So literally, Google will give you a score of 1 to 100 on something like one of the things is called SEO. Another category is called best practices. So think about each category and Google giving a score of 0 to 1 to 100 in every one of these categories for every single page. Again, higher the number, ideally 90 plus in all 4 categories, you're getting an A in Google Lighthouse Score. So if you want a given page to rank, so let's say you have a page on implants, you need to make sure that this Lighthouse Score is high, 90 plus in all 4 categories. Now in LifeSmile's case, there are 100 plus pages that are indexed by Google, and we make sure that all those pages have a high Lighthouse Score. We do this for all the clients we work with. Now the challenge with Lighthouse Score is typically the algorithm is changed at least once a month, and in some cases once a week, just the Lighthouse Score algorithm. So Google may have given you a wonderful score 2 months ago, but today you're getting a really bad score. So our teams are constantly checking for Lighthouse Score and then fixing it. Last but not least, I want to touch on keywords and phrases and how do you incorporate them. So we start with Google Analytics. We look at all the keywords you're ranking for, both in the top 3 spots of Google results and the top 10 and beyond. So let's say there's a particular keyword, implant 60616, maybe that's your zip code, and then 39 people in the last month are typing that keyword. Let's say you are in the top 3, great, do nothing or just keep doing what you're doing so you stay there. Let's say you are 39, that means nobody's seeing you for that keyword. So our team realizes it's a wonderful keyword, you want to grow your implant business and we want to go after it. So we will study what your competition is doing, who is maybe number 1 or number 2 for that keyword, and do more of those things. And when we look at all the things that we need to do more of, it goes back into those buckets. Few things that Gary didn't touch on, I'm not going to touch on them, but I'll just name them so you know what they are. Google Eat, it's expertise, authorities. Trust, that's something that Google pays attention to. Backlink, very technical, another thing that Google pays attention to.